Okay, hi, I'm Madison, and my case study today is on brachial artery aneurysm. So, patient history. The patient came into the doctor's office. He was having pain in his right arm. He also had a lump on his right arm. He had a history of Ehlers-Danlos syndrome, and he was also born premature. This patient was only 2 years old. Laboratory values. So the patient had labs drawn to be sure that the lump was not from any sort of infection. His platelets and white blood cells were checked. The patient's labs came back normal. Even though the patient was experiencing a lot of pain in his right arm, he was deemed otherwise completely healthy. Presenting symptoms. The patient came to the doctor's office because he was experiencing a painful lump in his right arm. The patient was only 2 years old, so the team was unable to ask the patient very many questions. They knew that the lump was painful for the patient because he let out cries whenever it was touched and was constantly holding his arm. The mother of the patient also said that they had noticed that the lump had increased in size, and as it grew, it became more painful for the patient. Image findings. So there was two scans that were done. One was an MRA and the other was a Doppler ultrasound. The Doppler ultrasound showed multiple segments of the right upper arm with turbulent flow and fusiform dilation of the brachial artery. And the MRA showed multiple contiguous segments of fusiform dilation of the brachial artery that was extending into the ulnar artery. Pathology. So for this one, they didn't do any pathology as far as when they found the aneurysm. But before this, since he had the Ehlers-Danlos syndrome, pathology had been done to diagnose him with that. And when you have EDS, it's a group of disorders that affects connective tissue, blood vessels, skin, collagen productions, and joints. So incidence. Brachial artery aneurysms are actually very rare and only seen in about 0.5% of patients. They are mostly related to cardiac anomalies. So etiology. Common causes of brachial artery aneurysm are cardiac anomalies such as Marfan syndrome, vasculitis, infection, and Ehlers-Danlos syndrome. Physiology. The physiology of the brachial artery aneurysm is a little different than most cases due to the patient's previous diagnosis of Ehlers-Danlos syndrome. A brachial artery aneurysm can be both traumatic